the simple urinary tract infections are because women and men are not drinking enough water. You know, we are living in a very hot climate in northern India, as a matter of fact, all over India.
Right.
The climate is very hot, it's very humid, and very often we get UTI just because we are not drinking enough.
Hello, friends, and greetings from VLCC, and a very good evening to all of you. I'm Dr. Anju Khai, Vice President and Head Preventive Healthcare at VLCC, and I'll be your host for the session today to understand what urinary tract infection or UTI is and what causes it, how to prevent it and cure it. So our expert panel includes Dr. Ashok Sarin, India's leading nephrologist, and eminent cardiologist, Dr. Dheeraj Bhatia, and nutrition expert, Dr. Deepti Verma, each of whom you'll meet shortly. And of course, you know about VLCC with 310 locations in 143 cities across 12 countries in South Asia, Southeast Asia, GCC region, and East Africa is, of course, the leader in beauty and wellness arena. Our wellness program is recommended by IMA, the Indian Medical Association. And today's session, as always, is part of our monthly webinar series, our educational contribution to holistic wellness through quality information and healthy lifestyle choices. So before diving into the topic, let me first set the stage. So urinary tract, what is it? Like, urinary tract is part of our body's drainage system. It removes urine, which is made up of our body's waste and extra fluid, and it includes 6 organs: 2 kidneys, 2 ureters, a bladder, and a urethra. So these 2 ureters, they bring urine from kidneys to the bladder, and from there, the urine comes out of the body through urethra. And for normal urination to occur, all these parts, they need to work well and in correct order. So males have longer urethra than females, and they also have a prostate gland, which often affects their ability to pass urine freely as they get older. The male urethra transports both semen and urine, while in females the urethra transports only urine. But our urinary tract is so beautifully designed to keep the bacteria out, but bacteria can still make its way in. So the urethra is the connection from the inside of our bladder to outside of your body, and that's usually how bacteria gets in. So UTI is bacterial infection of urinary tract. And the infecting bacteria, they multiply quickly. And most of the time, the infection will be in your bladder, but ultimately it can be anywhere along the tract. At some stage or the other, most of us have experienced UTI, and I'm sure we have so many questions. So our panel of experts will address a wide spectrum of common queries which we have received from you during registration for this webinar regarding UTI. And these include the causes, the symptoms, the diagnosis, its management, especially in young females during pregnancy, the menopausal women, elderly men, with prostate enlargement, and also the chronic recurrent infections, the dietary approach, and also some exercises, how to help those who have a leaking bladder. So there's so much to come. So I will therefore now invite our panel experts to address them, and I'm so delighted to welcome and introduce to you our first panelist for today, Dr. Dheeraj Bhatia. Dr. Bhatia has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Fortis Escorts Heart Institute and Research Center and Max Super Speciality Delhi. He's in fact been honored twice by DMA and IMA as their Doctor of Excellence awardee, and he's been also part of core medical research team which has laid down guidelines for defining and management of obesity and PCOS in Asians. And of course, he's the senior medical advisor to VLCC for last 20 years. Good evening, Dr. Bhatia, and welcome to the webinar. And thank you so much for joining us today.
Very good evening, Dr. Anju, and good evening to all viewers, and especially to Dr. Ashok Sarin, a very, very dear and old friend of mine. Dear, young, but old from all the years. That is very, very old. Okay, so Dr. Anju, let's set the ball rolling. What was the first? I think you have a lot of questions from our viewers.
Yes, absolutely. We have a lot of
let's questions. Go with, let's make it interesting with, question and answers. Okay. So whatever you say.
Right. Yeah. So the first question, Dr. Bhatia, to you is, what exactly is urinary tract infection, and are there different types of it, and who is more susceptible to it?
Right. So basically, urinary tract, as the name implies, infection. It's basically an infection. And the commonest kind of infection which you get is bacterial, which most women suffer sometime or the other in their life. There are certain susceptibilities, which we will go into very soon. But usually the bug is bacterial. And rarely, of course, we come across fungal infection also. Fungal is more in cases of people who are immunocompromised or people who are severely uncontrolled diabetics in that group. But by and large, we see a lot of infection, bacterial, and even in people who don't have any risk factors, so that's interesting. And there are some couple of reasons for that. We'll discuss that as we go along. The commonest bug is a bacteria called E. coli. E. coli, Escherichia coli, and that is what is very, very common. And the question which you asked was, what is the susceptible
group? What are the different types of
different types? Right. So types, they're defined into lower and upper. So as the name suggests, the bladder is lower. So it's all around that area. So then we say cystitis, So that is one group which is defined as the cystitis group, or the lower UTI. And the upper, and in that you include, of course, you can include your urethra also, which is the outlet portion, the last part of the drainage. And then you have the upper, which is pyelonephritis. Now that's the dangerous one, because as infection goes up, pyelonephritis means literally like pus in the kidneys, in a way. So you're affecting the kidneys if you're not treating it, at the first level, which is the lower UTI. Of course, you can get an infection straight on the kidneys. That's a different issue. But usually it kind of moves. And then, of course, the symptoms are different. We can just discuss that later. But the other part which you said, who are the people
who are the people who are more susceptible?
Right. So, usually it's more common in females, and more common in females because E. coli usually comes from the fecal matter. And in females, the anus is closer to the urethra, much closer. So therefore, the infection is passed on, especially, you have to be very careful about hygiene. And then if they have diarrheas or chronic diarrheas, so that can happen. Then diabetics, people who are obese. Very important, they say 80% today in the West, of course, India studies are not there, but abroad, 70 to 80% of the cases are because of indwelling catheter. So people who land up in hospital and who have a catheter, indwelling catheter, because they're not passing urine post-operatively or because of age or some neurological problem, there's a very, very big group where there's this mega problem. Then, of course, vaginal infection can cause it. Recurrent UTI, people who have had UTI in the past, maybe there's a genetic predisposition, but they will keep having it again and again. Pregnancy is another very big group. So pregnancy also, one should always keep in mind, when the frequency increases, that's another very big group. Right. So these are then of course, people who have renal transplant and, people who are in renal failure, immunocompromised, there's an, excuse me, Absolutely. And in male who have got a prostate enlargement. So this kind of group also has a problem. Yes.
Absolutely. Thank you, Dr. Bhatia. And the next question is again, people are wondering what kind of symptoms indicate that you have a possibility of UTI. Yeah.
So symptoms, again, you divide them according to what type. Like you said, what are the types? So there is lower and upper. So lower means bladder. So bladder symptoms are going to be what? They're going to be like, increased frequency, burning, and then dysuria. Dysuria means painful micturition. And it's very bad. They cry out. They feel that somebody is cutting them inside with a knife. So that is a terrible kind of feeling they get. Then they get this suprapubic pain. So that is the thing. Now, when it shifts to the kidneys, which is called pyelonephritis, the symptoms become more intense. These same symptoms are there. To repeat, they have dysuria, painful urination, increased frequency, running, urgency. They have this thing to, sometimes they say we can't even reach the bathroom and we just pass urine. But as it gets worse, then fever comes on. And that means pyelonephritis. So that is then they get a lot of pain in the flanks, in the renal angle, at the back. So they complain in the lumbar region. They start complaining of a lot of heaviness or even acute pain. And then they get fatigue, tiredness, nausea. They feel fever comes with chills. So, chills, like a lot of people, differential diagnosis, when you have personal fever with chills, always first think of malaria. And then the second you think of a UTI. So dengue, of course, also you have chills. So this is how we can tell. But then in these cases, you will have, of course, now you will always find that people with this pyelonephritis symptoms, like this fever and pain in the flanks, they don't come in. These symptoms are not there when there's a bladder problem. But the bladder symptoms are always there when there is a kidney problem. That's interesting to note.
Right.
So that is very interesting, especially this nausea, fatigue, flank pain, fever, chills. That means it's ascended. And that's the red flag. Then you need to be really careful and alert. Right.
So, Dr. Bhatia, are there any other medical conditions like which display the same symptoms as UTI and we get confused with it?
Yes. So, I think you need to take a doctor needs to take a very good medical history. So if a lady has, let's say, a vaginal infection, right? Vaginal discharge or infection, and there is inflammation there, she'll again get the same symptoms. She'll get an urge to, again, urinate again and again repeatedly. So that's going to be an issue. So a good history, if there's any vaginal discharge, foul smelling or otherwise, one should always take. Then people, who are taking a lot of coffee, the frequency will increase because of caffeine. Right. Similarly, even colas have a lot of caffeine. So there you go. People taking a lot of tea, there can be a problem. People who do not know that they're diabetic and suddenly they become diabetic. One of the first symptoms the first symptom really is fatigue and passing more urine. Frequency increases. And that's why you pass more urine, then you're going to start feeling thirsty because your mouth is going to dry up. So again, taking a history about that is extremely important. So pregnancy is another very important part. Pregnancy, a person may not know she's pregnant. And her first symptom may be that her frequency is increased. So therefore, it's a good idea to find out when the LMP was, the last, last menstrual date. Then a history of diuretics is very important. Are you taking, Lasix, or you're taking some other diuretic, which causes increased urination? Prostate enlargement, that itself, because it presses on the urethra. Without having it, you can have this problem, the increased frequency. So these are some of the important kind of things which we look at. Yeah.
Thank you, Dr. Bhatia. And we started with the bacteria which infects our urinary tract. And so, according to you, what is the most dangerous bacteria which can infect the UTI?
So the most dangerous bacteria is Pseudomonas. The most common one is E. coli. So E. coli, the management, I think Dr. Sarin is the best person. He has vast knowledge, so I'll leave it totally to him. But commonest one is E. coli, and the most dangerous one, Pseudomonas, which I would actually treat by injectable, especially if it's hospital required. But since we are really, to just wind off, since we're talking more about preventive thing. Right. So he will of course take the management, but since you're talking about the preventive, a few tips for the viewers. One is never hold on to your urine as far as possible. Try to pass and drink sufficient amount of water. You hold on to your urine, then there are issues of stagnation, especially if the prostate is enlarged. So I would advise one thing is never do that. Drink plenty of water. Very important part is when you wipe, in case one is using swipes and not using water, especially in public places, then always make sure that one does not wipe from the back to the front, because you're taking infection from the anal region, the fecal matter up in the front, and that's how the infection comes. So you make sure that you're always wiping from the front to the back. It's a simple tip like this. Also very important is people use condoms. There are condoms which come with spermicides, and those condoms with spermicides should not be used. A lot of people don't realize, the youngsters, they use the one with spermicide. The spermicide, why it creates a UTI? Because it changes the flora of the vagina. Simple thing. That's the reason. So just use a simple plain condom, not the ones which come, these fancy ones which you get from wherever. And one should really. And lastly, whenever one has sexual activity, one should, even if it's middle of the night and one is tired, get up and pass urine. It flushes the system out.
Right.
So these simple tips, which I think it's very important. Drink a lot of water. Don't hold urine.
Very useful.
Yeah. So
very useful, Dr. Bhatia. And just to end, what would be the simple investigations required to rule out the UTI?
Always start basic. So basic is urine routine. Just get a urine routine. Usually, if it's pus cells, a lot of people ring me up and say, doctor, we had 4 to 5 pus cells. Doesn't matter. The pus cells have to be 6 to 7 at least before you culture. You find something on culture. And then, of course, they look under the high power field. It should be 10 to the power of 5 per bacteria, lying there. Then okay, you're going to culture something which is going to be there. So urine routine is very, very important. More than 6 to 7 pus cells and some casts, I would be worried. Urine culture will give you a clue. 48 hours, 72 hours culture will tell us. Thirdly, I would do an ultrasound to see there's no obstruction, which is another big risk factor. Like, any stone there, or in children, if there's any congenital defects of the urine flow. Because whenever, river is not flowing properly, it's not going to be clean. There's going to be stagnation and there's going to be a problem. Last comment, that we have something called, you see a lot of pus cells in the urine. Let's say 40, 100, 70. When you culture it, you'll not find anything. And people wonder why. So there are 2 important causes. Very important causes, which I think the viewers should take home. One is it could be renal tuberculosis. So that we call sterile pyuria. Sterile pyuria, which means there's pus in the urine, but there's nothing growing. But then you have to do different kind of cultures. And we do something called PCR. Those polymers, that's a new thing, polymers chain reaction. Also, some collagen disorders also behave like this. Collagenosis, like SLE, you'll have a lot of pus cells, you'll not have this. I think enough for the day.
Thank you so much, Dr. Bhatia. So for the viewers,
we've got a legend sitting with us. He should take. Dr. Sarin is a legend. He should take over.
Thank you so much. So you just need to get your routine urine, and then if required, the culture, and then ultrasound if required. Just leave it to your doctor to decide, and that's what is going to work for you. Thank you, Dr. Bhatia, for laying the foundation for today's discussion. And let's go forward. And I'm so very pleased to now introduce our special guest on the panel, Dr. Ashok Sarin. Dr. Ashok Sarin is Senior Consultant Nephrology with Apollo Hospital, New Delhi, where he's worked for over 25 years, and he's been the coordinator in the Department of Nephrology as the thesis guide and teacher for DNB candidates. His experience stretches from All India Institute of Medical Sciences in Delhi to the Belfast City and Royal Victoria Hospitals in Belfast, Northern Ireland, where he trained in nephrology and cadaveric renal transplant. Dr. Sarin is Fellow of Royal College of Physicians, Edinburgh, and has been President of Delhi Nephrology Society and President of Indian Society of Nephrology, North Zone. So, welcome to you, Dr. Sarin. Welcome to you to the webinar, and thank you so much for joining us today.
Thank you very much, Dr. Anju, Dr. Dheeraj Bhatia. It's been so kind of you to have invited me. Now, what are you going to ask me questions or? Right.
There are some questions for you, Dr. Sarin. So let me start with the first question. So the simple one is, what are the causes of urinary tract infections actually?
Look, the most important causes are in men and women is obstruction. Now, obstruction anywhere in the urinary tract, like stones, like stricture urethra, PUJ obstruction, which is high up in the kidney, stones, renal stones, and then in men, prostate. So these are the common obstructive elements are very important in the cause of urinary tract infection. Then also an immunocompromised host. Now, a person whose immunity is down due to diabetes, due to glycosuria, there's a lot of sugar in the urine.
Right.
And bacteria love sugar, and therefore the person with diabetes is going to develop UTI very readily, very commonly. Then immunocompromised host, a patient who's on steroids. Steroids are used in the treatment of many diseases. Patients who are on steroids and other immunosuppressive medication, for example, in our patients, renal transplant and all that, I won't go into the details. So immunosuppression is another reason, and obstruction.
Right.
Catheters, as Dr. Bhatia had already mentioned, catheters, and then of course, very commonly, the simple urinary tract infections are because women and men are not drinking enough water. We are living in a very hot climate in northern India, as a matter of fact, all over India.
Right.
The climate is very hot, it's very humid, and very often we get UTI just because we're not drinking enough.
Right.
And then as Dr. Bhatia had said, that women sometimes, because we don't have toilets readily available, they don't pass urine. And you'll be quite surprised to hear that once I had a patient, which does not happen commonly, who had renal kidney failure because she was in the habit of not passing urine for the whole day for almost 24 hours. Wow. And she would pass urine late in the evening in her house. And then she developed back pressure changes and in the kidney. It's not common, but women, as Dr. Bhatia said, should pass urine regularly and must drink a lot of water.
Right.
So these are some of the common causes.
Right. Thank you so much, Dr. Sarin. And of course, we touched upon the UTI, which is so very common during pregnancy. So what tips do you have for our viewers for that, Dr. Sarin?
Look, if ever a woman who's pregnant gets urinary tract infection, she'll have symptoms like burning or whatever, and fever also, then the urine should be examined, urine routine and urine culture. And if it is positive, as 10 to the power of 5, it should be treated with simple antibiotics. I very often get in touch with the obstetrician, where in conjunction with her, because she has a fetus, I don't want to give antibiotics which can be dangerous to the fetus. So simple antibiotics like nitrofurantoin or trimethoprim can be given to these patients for a short duration.
Right.
Because UTI can cause problems, it can cause premature rupture of membranes, can cause low birth weight babies, and if it spreads into the mother, it can cause septicemia, which will harm the mother and the fetus. So, it must be treated very quickly. It can be treated by simple antibiotics.
Absolutely. Absolutely. So, yes, so like Dr. Sarin has just mentioned, this is for everybody. If you notice any symptoms of UTI, if you're pregnant, please do not ignore and seek medical opinion at the earliest, because untreated UTI can cause complications and which can become really serious during pregnancy.
Even abortions and miscarriage.
Right.
Is common in pregnancy just because of UTI.
My goodness.
Which can be treated very easily.
Absolutely. So, so the message is loud and clear. Do not delay. Just immediately get in touch with your doctor and get treated. So, Dr. Sarin, is there any difference of approach while treating the menopausal women?
Yeah, menopausal women, because of vaginal atrophy, we must use these estrogen preparations as creams. And because the bacterial flora is lost and the lactobacilli and all are lost, so they readily develop urinary tract infection. So if we apply these estrogen creams, then we can keep these harmful bacteria away and can get the lactobacilli and all in the urinary tract, which will ward off harmful bacteria.
Absolutely, absolutely. So
there's no role for estrogen tablets in this case. It's only local creams.
No, that's about it. So the local estrogenic creams are required just to take care of the dryness.
In vaginal atrophy.
Absolutely. Thank you. So also, it has been seen, Dr. Sarin, that in elderly people, sometimes we often are told to ignore the occasional pus cells that we get in urine tests, and there are no symptoms at all. So, is it important to treat them if there are
No,
no
in
symptoms?
elderly people, especially if they're asymptomatic,
Right.
and there's no obstruction. You know, obstruction in the urinary tract, for example, a prostate or a stricture or stones in a male or female, if they are there, then significant UTI, for example, when the culture shows bacterial count of 10 to the power of 5 or more, that should be treated. But the stray pus cell here and there, the patient doesn't have any symptoms, there is no obstruction to the urinary tract, there's no point in pumping in antibiotics. They have absolutely no role.
Absolutely, because that is what happens whenever we generally get our general checkup and we get the urine tested and there are few pus cells, but there are no symptoms. And, you know, the tendency is to just go in for...
As a matter of fact, asymptomatic bacteriuria in women, not in men, need not be treated. If a woman has significant bacteria in the urine, she doesn't have she doesn't have obstruction, she doesn't have diabetes, she is not on immunosuppression, she is a normal woman, it does not have to be treated, but because it will not cause any problem. If she comes to know, just drink a lot of water and things will be sorted out.
Absolutely. Wonderful. Dr. Sarin, so there is a question now that we hear of recurrent UTI, that is infection occurring again and again and again. And so why does this happen? And especially if there is no underlying cause like renal stones or prostate enlargement.
No, recurrent UTI is defined when there are more than 2 episodes of urinary tract infection in the last 6 months or 3 episodes in the last 1 year. And this is because of alteration of the bacterial flora, and also because in the uroepithelium, sometimes bacteria get entangled, enmeshed in the urinary, the uroepithelium. And therefore, you have to give them, of course, we found out that there's no obstruction, there's no immunosuppression. In this, we have to give low dose antibiotics for 6 to 12 months, like nitrofurantoin, 50 to 100. First, we treat the infection, then we give them long-term antibiotics like nitrofurantoin, 50 to 100 mg daily at night after meals, or trimethoprim sulfamethoxazole, especially if the person is not allergic to sulfur. So there are other simple antibiotics which can, in low dose, can be given for 6 to 12 months, and this is recommended.
Okay, but of course, people have to take it under supervision of the doctor.
Yeah, always under, yeah. Once the doctor decides that it is recurrent bacteriuria and there is no other underlying cause,
right,
then we give low dose antibiotics for a length of time, because otherwise she'll be very hassled and disturbed by recurrent episodes. And then very often we are able to get rid of the bacteria and she does not have episodes of UTI.
Fantastic. Doctor, you just said that bacteria love the diabetic blood and they love the sugar. So diabetics, you know, they really get troubled with UTI repeatedly. Any special advice to them, please?
Look, in diabetics, diabetes is bad for any and every part of the body, right from head to toe. So therefore, the bacteria love not only the blood, the hyperglycemia, the excessive sugar in the blood, but the excessive sugar in the urine. Right. So very often they have glycosuria, and the bacteria have a feed. And you see, nature has made things in such a way that if the fasting sugar is 100 and the postprandial is 140, nothing goes wrong. Moment the sugar is 120, 130, and the postprandial is about 170, 180, bacteria will come in. So we must control the important thing is, if diabetes is very common in the obese, especially in the type 2 diabetes. So obesity should be curtailed, the dietary restriction, exercise. So the lifestyle modification should be done. And then, of course, we'll have to treat the blood sugar. We have to treat with medication or dietary alteration so that the blood sugars remain normal. And the normal blood sugar, fasting is 100. Postprandial, 2 hours after a meal, is 140 milligrams %. And an HbA1c, which tells us the blood sugar status for the last 3 months, it should be 6%. Anything higher is diabetic. So if once we control this and then we give a course of antibiotics, we will get rid of the infection.
Wonderful. So the next obvious question is, Dr. Sarin, what would be the general line of treatment of UTI like? What is the process like?
Look, in uncomplicated UTI, we will give them a short course of antibiotic for about 5 days. We don't have to give long, but there's no immunosuppression, there is no diabetes, the woman has just had an episode of UTI. And then we can alkalize the urine to alleviate the symptoms. Then we can give, non-antibiotic like cranberry extract. This is not an antibiotic, but it is a fruit, as the name suggests, which help to, on the fibria of the uroepithelium, they get attached and they do not allow the bacteria to come there and cause the inflammation. Then, of course, we've got simple antibiotics like nitrofurantoin, we've got trimethoprim sulfamethoxazole, and then sometimes we can give, it is not done commonly under the supervision, medical supervision, in very difficult cases, intravesical, that is injection into the bladder. Of course, this has to be done by the doctor.
Right.
And as Dr. Bhatia already mentioned, that in young women post-infection, drink a lot of water after sexual intercourse, don't use spermicidal creams, and use if supposing somebody post-coital develops UTI, then you give them a short course of antibiotics. So cranberry extract is very interesting, and in recurrent UTI, you must use. Otherwise, the simple antibiotics. It's only in complicated UTI that we use the quinolones and the other drugs, which, of course, the doctor will prescribe.
Wonderful. Dr. Sarin, there is any chance that while we are treating a woman who is breastfeeding, it would affect the baby who is,
Look, trimethoprim sulfamethoxazole should not be given to a baby who is 3 months old. I mean, breastfeeding a baby who's 3 months old. After that, we can give it. And then simple antibiotics like nitrofurantoin, cephalosporins in the form of cefotaxime and all can be given for UTI, so can nitrofurantoin. So
Wonderful.
These antibiotics, simple antibiotics, are safe even during breastfeeding.
Great. Great. Thank you so much, Dr. Sarin. And this has been wonderful. And thank you so much for sharing your experience and invaluable advice. Our attendees and we too have benefited with better understanding of what, why, and how of UTI. Of course, this will remove many misconceptions and anxieties. And of course, we will invite live questions from our audience at the end of our discussion, and we look forward to further advice from you later. Thank you so much.
Thank you.
Yeah. So going forward, the diet, the exercise, de-stressing, and other healthy lifestyle measures have very significant impact on our well-being. So let's first see how diet impacts UTI. So I'm pleased now to introduce our next panelist, Dr. Deepti Verma, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development. She has been a lecturer, a medical nutrition consultant, an editor, and she has been felicitated with several awards to her contribution towards nutrition, including a Lifetime Achievement Award. So welcome to the webinar, Dr. Deepti, and let's see, we have questions coming up for you. And the first one, of course, is can our diet help us manage UTI? What would you suggest to that? Dr. Deepti?
Yes. Am I audible?
Dr. Deepti, can you hear? I think we've lost her. Okay. We will come back to Dr. Deepthi. Meanwhile, let me, touch upon a related problem of urinary incontinence, the loss of bladder control, which is such a common and often embarrassing problem as we, get older. This severity actually ranges from occasionally leaking of urine when you cough or sneeze, or having an urge to pass urine that's so sudden and strong that you can't actually reach the toilet in time. So to prevent this urinary incontinence, we do have something called as pelvic floor exercise. Now, which is also called the Kegel's exercise, which help hold the urine in the bladder by strengthening the muscles involved. So daily exercises help keep urine from leaking when you sneeze, when you cough, when you lift anything heavy, or laugh, or even have a sudden urge to urinate. And these exercises also may help avoid infections by strengthening the muscles that help empty the bladder. So what are these Kegel's exercise, and what muscles are we talking about? Actually, these pelvic floor muscles, they are in the form of a sling, and they are down below, which hold the bladder and other organs. And in fact, you can try stopping urine midstream. When you're passing urine, you just try to stop it, and that's what actually are the muscles we need to exercise, that is holding your bladder or trying to stop passing urine. And that's what is contracting the pelvic floor muscle, because these muscles, as we age, they become lax, and simple sneezing also cannot stop the flow of the urine. So you just need to hold the bladder for at least 3 to 5 seconds at a time, and do it as and when you remember during the day, which is a good start, but gradually build it up to 3 sets of at least 10 repetitions every day if you're suffering from it. And the best part about Kegel's exercise is that nobody else will know that you're doing them. Not only Kegel's exercise, any physical activity in general can help prevent bladder problems. It can also help maintain a healthy weight, because we've seen overweight people display a higher tendency for UTI and leaking urine. So making healthy food choices, being physically active can help manage the weight and the UTI. And of course, it has been seen that those who spend a lot of time sitting, say more than 5 hours or so, and or maybe having low physical activity in general, are more likely to experience incomplete bladder emptying, increased urinary frequency or urgency, a weak urinary stream, or having to get up frequently to urinate at night. So the fixes, whenever you are sitting for long hours, try to get up after every hour and take a round, go for 5 minutes around, walk around, or maybe better still, get a standing desk, right? Let's see if Dr. Deepthi is back. I don't think she's getting the network. Anyways, when we talk of the diet for UTI, we need to have the acidic diet, or the diet which has more of, the colas, more of tomato based, or the junk food, and all the acidic food make our pH of the body acidic, which is a breeding ground for bacteria in our body, so also for UTI. So try to have alkaline food, fruits, vegetables, healthy grains, and probiotics, prebiotics. And of course, Dr. Sarin also mentioned about the cranberry juice. Dr. Sarin, would you want to talk about the cranberry juice?
So Dr. Gai, I'm back. I think I just lost y'all for a bit.
Oh, okay, welcome.
welcome
Am I
back.
audible now? I'm so sorry
Yes.
about that. There's some network glitch here.
No worries, no worries. Welcome, welcome. So nice to have you back, Dr. Deepti. And we already had introduced you. So welcome back, and let's get started. So how does the diet help the UTI? I started off with some information, but there you go. You're the expert here.
Yeah, so as far as the diet is concerned, it's very important to keep the diet alkaline. So alkaline diet basically comprises of whole grain cereals, fresh seasonal fruits, and fresh seasonal vegetables. So consumption of that makes the blood very alkaline, and an alkaline body is always a fitter body and has a better immunity. So of course, like we have to avoid all the acidic foods like tea, coffee, alcohol, nicotine, and processed foods, which are very, very important to be kept off, when someone has recurrent UTI issue. The second very important thing is the constant intake of pre and probiotics. So pre and probiotics, like they breed the bacterias, and probiotics contain the bacterias. So some of the foods that I would recommend is bananas, cabbage and cauliflower, the cruciferous vegetables, which are very good prebiotics. And other than that, of course, is avocados and raw onion and raw garlic. They are considered to be very good as prebiotics. And as far as the probiotics are concerned, it is all the fermented food, and it is also, like curd, which has a lot of live bacteria in it. So these foods can be taken in more quantity. So that's second, pre and probiotic foods. The third very important thing is intake of vitamin C, but through non-citrus foods like amla, guava, the coriander chutney that we normally take here in India, the green chutney, which is very, very rich in vitamin C. And of course, like amla, which is the Indian gooseberry, very rich in vitamin C. Fruits like papaya, watermelon, muskmelon. So these are supposed to be taken because vitamin C, almost about 4 grams is required, to beat the UTI and the infection and builds in immunity. And another very important thing is to cut down the white sugar, because it is said that white sugar drastically drops down the action of the white blood cells, the WBCs, that actually gives the immunity. So yeah, these are primarily, of course, other than that, as Dr. Bhati and Dr. Sarin have already spoken, intake of water has to be increased.
Absolutely.
So,
yeah. So we come to the next thing which we were talking about, and Dr. Sarin also mentioned about the cranberry juice. How does it help us?
Okay, so cranberry juice indeed is actually all cranberry extracts for that matter. Now we get pills and all also, and there are different supplements of cranberry. So cranberry extracts, basically they contain, as Dr. Sarin has said, that they avoid, the bacteria clinging on the walls of the urinary tract. And second is they contain hippuric acid, which behaves like, an antibiotic, a naturally found, antibiotic compound like, and which also is very anti-inflammatory in nature and also prevents the symptoms of the UTI like frequent urination, burning, etc. And besides that, it is very, very rich in cyanates, because it's, like anthocyanins is something which is very high in, the cranberry extracts. So hence, it is actually highly recommended to be having the cranberry extract.
Wonderful. That's so awesome. Thank you, Dr. Deepti. And of course, food is always of special interest because it's 100% within our control, and wise choices can have such a significant impact on our health and well-being. Right. Thank you once again. So it's time to take a few questions. So Dr. Sarin, there's one of our viewer, Asmita Madan, and she says that, is it safe to use intimate hygiene products like toilet seat spray, toilet seat covers, intimate wash, etc.?
I don't think so. What is important is wherever, if you're talking of toilet seats, keep them clean. You can use a detergent. Right. Keep your seats clean, keep your bathrooms clean. I don't think there's a need for anything special.
Okay.
You're not going to get UTI from your seats. You're going to get UTI from yourselves.
Okay.
As we already said, it's coming from your Dr. Bhatia had also said, and I'm repeating, that from your own alien area, and therefore clean from front to back, in women especially, clean from front to back and not back to front. And there is no need to use fancy things, just keep everything clean.
Great. So Reena Barad has asked that if there is a cyst on the upper side of the urinary tube, what can we do for the treatment?
No, you see, which urinary tube are you talking about? Are you talking about the ureter or the pelvis of the kidney or the urethra? The cysts are not commonly, I see so many kidney and nephrology. I don't find cysts. Cysts are common in the kidney itself, and most cysts are benign and we do nothing about it.
Great.
We don't have cysts, and I can't remember, I have a big practice. I can't remember seeing cysts in the urethra or in the ureter. So I don't think we have to worry about cysts, but if you have a cyst here and there, you will have to go to your doctor or to your urologist.
Yes, thank you. Thank you so much, Dr. Sarin. So there's another question, women suffering from urinary incontinence, and I talked about the Kegel's exercise, and if that's also not helping, what is the next best thing to do? Because it's very, very embarrassing and very, very difficult time if you can't control your urine. So what do we do?
Is that a question for me? Yeah.
Sorry?
Is that a question for me?
Yes, sir.
Look, we have to make sure there is no pathology, like infections. If there is if whatever pathology there is, for example, somebody has a tumor in the bladder, a malignant tumor, or an infection, or cystitis, and that is the cause, we have to treat the primary cause. But if there is nothing, there is no pathology as such, and we call it stress incontinence, and it is more common in women, then of course there are now plenty of drugs available. Drugs which will, the overactive bladders, there are drugs to quieten the bladder. For example, darifenacin, solifenacin, there's a new one called Birago. So there are plenty of medicines available which are pretty safe and can be used. So medicines are available. And of course, if there is a cause for the incontinence, then the doctor will treat that cause.
Great.
One doesn't have to worry so much because there is medication available.
Okay. Thank you so much. So, Dr. Deepti, there is a question for you, and the viewer is asking that the cranberry juice, should we have the fresh cranberry and then make the juice, or we can have the the stored one or the packaged one? Is it fine to have that?
So if one can get the fresh cranberry juice, of course, it's always preferable to have that. Otherwise, there are cranberry extracts which are available online. In fact, today, while I was on my way to work, in one of the most popular stores in Delhi, I saw cranberry juice extract, so which was available in a very ordinary kind of, an outlet. So it's available everywhere these days because of its requirement and nutritional benefits. But yes, otherwise the extracts can be ordered online.
Yes, the only caution that we need to take care is that it should not have sugar mixed with it, and especially for diabetics, like we do have some sugar-free, packages also, right?
Yes, there are unsweetened cranberry juice, and it's mentioned on the packages that it is unsweetened because diabetics are very prone and susceptible to be having the UTI. So hence, most of the cranberry juices and extract that comes are unsweetened.
So the question just popped up is, how about just having cranberries rather than the juice?
Okay, so actually this is needed in larger quantity. If I talk about the quantity, so like anthocyanidins which are present in the cranberry are required in the quantity of almost 35 milligrams. So that would come only when we have the juice, because otherwise we'll have to eat a lot of cranberry. That makes actually 2 glasses of juice. Absolutely. So that will become a little too much. So because of that, we need to actually drink in a fresh juice or whichever way, so it has to be fresh for sure.
Okay, great.
Yeah.
So I think, let me just check if there are any more questions. Okay. So somebody has asked, please tell again from Nikita. She's asked, please tell me again about the exercise. So yes, Nikita, I will repeat for you. This is the Kegels exercise that we are talking about. So this is to prevent the leakage from the bladder when because the muscles which form the floor of the pelvis, or at the lower end of our abdomen, the pelvic floor, there are muscles which form a sling, kind of it's like a sling which holds our bladder. It helps to contain the urine whenever there is a pressure or anything. So you just need to contract these muscles. And how do you do that? You do that as what you do when you're trying to hold your urine, when you're very urgently wanting to pass it. So when you're holding it tight, that is what is the contraction of the pelvic floor muscle, which is called the Kegels exercise. That, and I said, if you want to try it, you can do when you're passing urine midstream, try to hold it. Try to stop the urine, and that is what is the contraction of the pelvic floor exercise. You can do it whenever you want to do it. Nobody can know that you're doing it, but it will really help you to a certain extent to hold the urine and not just have the leakage whenever you lift heavy thing or laugh or sneeze, so that's what is the Kegels exercise. Okay. All right, so that's about it. So let me just try to summarize. And we have told again and again, don't hold your urine in your bladder for too long. It can weaken your bladder muscles and make bladder infection more likely. Use washroom often and whenever needed. And be in a relaxed position while passing urine. This will make it easier to empty the bladder completely, especially for women, hovering over the toilet seat, especially when we are traveling and we don't want to sit on the toilet seat. And so that does, it's hard to relax, and it's best to clean the seat and sit on the toilet seat and then pass the urine. Take enough time to fully empty the bladder. Don't be in a rush and apply excess pressure, which may not allow the bladder to empty completely. And like, again, this is very important. Dr. Sarin, Dr. Bhatia have already talked about it. By using the tissue paper, wipe from front to back after using the toilet. And women, especially women, because the gut bacteria from the anus can get into the urethra, and this step is very important, especially after passing stools. So also Dr. Bhatia mentioned urinate after sex to lower the risk of infection. Otherwise, bacteria from the bowel or vagina cavity can pass into the urethral opening. Like I said, do pelvic floor exercises, especially if you're getting older. That will really help you. Exercise regularly. Physical activity helps prevent bladder problems and also actually helping you maintain your weight. And because overweight people are at higher risk for UTI and leaking urine.
Dr. Anju, one last comment.
Yes, please.
Some of them are asking about D-mannose. So they want to know D-mannose health. So D-mannose is nothing but monosaccharide. It's the same thing like in cranberry juice. So to reiterate, it works, it's got direct, like Dr. Dipti was saying, antibacterial, but somehow it works very well against E. coli, which is the main culprit in UTI. But one thing is very important to remember, that if you're going to think that you're going to take D-mannose, which is like cranberry juice and other berries also, and be all right, it's not going to work. You need to supplement it with a proper antibiotic. But where, yes, it really helps, this is the take-home message, that if you have to take medication for long, like 6 months, a year, in chronic UTI and recurrent UTI, like Dr. Sarin was saying, then you must supplement with cranberry extracts. Very
Great.
and lastly, there are enough cranberry tablets now available. concentrate, like Ricky said, made a good point that you need a very high dose. So drinking, glasses are not going to help, and you'll be taking so many calories, whatever. They may be minus sugar, but you will get calories. So best is to take those tablets and take a good brand, and especially in chronic cases. So take home message is very important, antibiotic plus D-mannose, because the ladies, some of them are asking about D-mannose. So this is the thing about D-mannose.
Okay. Fantastic. That was really helpful, Dr. Bhatia. And of course, not to forget water, like drink enough water. That's the best thing. And,
right.
That's the treatment also. And that's a prevention also. And
drink enough water and not beer.
Absolutely. I was coming to that.
It's evening now.
Limit alcohol and caffeine because drinking
acidic
alcohol.
urine.
Yes, absolutely. Drinking alcohol and caffeinated drinks will actually make you pass more urine and irritate the bladder and increase the symptoms.
They say in the evening a smoke and a drink brings smile to a man's face, but the bacteria are also smiling down there.
Absolutely. Yes, and not to forget, avoid constipation also. Too much stool built up in the colon can put a lot of pressure on the bladder and keep it from expanding the way it should. So eating, like Dr. Deepthi said, eating plenty of high fiber food, whole grains, vegetables and fruit, drinking enough water, and of course being physically active can prevent this from happening. And not to forget smoking. Bladder problems are very common among people who smoke. It has been seen, and smoking can actually also increase the risk of bladder cancer. So it's best to take steps to quit. So that was all about the summary, and of course we've had a good session. And I would like to just say that at VLCC our focus is on the combined benefit of managing diet, activity, lifestyle to keep our clients healthy and well for life. And that is why our team of doctors, physiotherapists, nutritionists, therapists, wellness counselors, we all work together on custom designed regime for each client to help them achieve their wellness goal, and not only just weight loss and body shaping. So thank you all for attending our webinar and guiding our conversation with your wonderful questions. And special thanks to all our panelists, especially Dr. Ashok Sarin and Dr. Bhatia and Dr. Deepthi for all your learnings today. And we really hope now all of you have better understanding of your health for yourself and for someone you may know. And if you wish to know more, there is a VLCC center near you where our team of experts is waiting just to meet you. So wish you all a very healthy life filled with happiness and fulfillment, and a very good day to you. Thank you so much.
Good night, everybody. Thank you. Thank you.